I live in Canada and right now it looks like this outside. My name's Sydney, I'm a labor and delivery nurse, and here are some things you might want to know if you live in conditions like this and you are pregnant. Pregnancy throws off a whole bunch of stuff in your body, but it does throw off your center of gravity, so you are more likely to fall. And especially if you're living in areas where there's lots of ice, falling is actually really common during pregnancy. Even if you slipped and fell and you were able to avoid falling directly on your stomach, I would still recommend giving your healthcare provider a call or going straight in to be assessed during any point in your pregnancy, but especially in your second and third trimester. When you get to the hospital, your healthcare provider is gonna ask you what time you fell and how you fell. They're gonna ask if you have any bleeding from your vagina, and then they're also gonna ask if you have any abdominal pain or uterine contractions, cramp-like feelings. And then they're also gonna ask you how the baby is doing. Are they moving like they normally do, or has there been a decrease in fetal movement? A fall during pregnancy can lead to what's called a fetal-maternal hemorrhage. So they might wanna do some blood work to check to see if there's any fetal blood cells in your maternal blood circulation. They may also do an ultrasound to check on baby and see if they can see anything that would indicate a hemorrhage or a placental abruption. And then this varies from place to place depending on their protocol, but you will be monitored on what's called an electronic fetal monitor for approximately 2 hours all the way up to 6 hours. And if you are having symptoms like bleeding or contractions, then they might want to keep you even longer and monitor you for a period of even 24 hours. If your blood type is what's called Rh negative, so if you have O negative, A negative blood type, they might want to give you a RhoGAM shot. So this is usually given in pregnancy anyways, but if you've had a fall or any kind of accident in any way, shape, or form, they might want to give you an extra dosage of the RhoGAM shot. Don't worry, a lot of times patients fall, they slip on ice. Try to be careful when you're pregnant, but these things happen. This is just an idea of what you should expect if you do have a fall during pregnancy. And I do always recommend giving your healthcare provider a call or just going in to be assessed. It's always better to be safe than sorry. Hopefully you get all this checked out and then you can just go home. Follow along for more tips and tricks about pregnancy, labor and delivery, postpartum, and newborn care. And I share tons of free information on my page, so I would really love if you guys could follow along for more.